and welcome to AWHONN Insights, the home for candid nursing conversations. Today, we're getting an inside look at what it means to be male in maternal health nursing. Our guests have unique experiences and perspectives and will shed light on how their lives influence their birth work. Our guests are Matt Medina, a certified nurse midwife and staff nurse at Brigham and Women's Hospital and an inaugural AWHONN Fellow. Curry Bordelon, an associate professor at the University of Alabama Birmingham School of Nursing and vice president of the American Association for Men in Nursing. Gabe Feynman, a labor and delivery nurse, transport nurse, and NRP instructor, and Eric Ruiz, a labor and delivery nurse for 9 years at Bay State Health in Springfield, Massachusetts. I'm your host, Bria Anopise, and I'm joined by co-host Jamie Agunste, a maternal mortality abstraction program coordinator. Jamie, enjoy the discussion. The podcast is all yours.
Thank you, Bria, and thank you to our 4 distinguished guests today. I'm so excited to have all of you here to talk about some of your really remarkable careers and to give a little bit of insight into some of the challenges you might have experienced and to some of the great things that you all are doing. So what I'd love to do is to go around the room and give everybody a minute or two to tell us a little bit about the work that you're currently doing and how you got into the field of maternal child health nursing. So we'll start with Matt.
Thanks, Jamie. I'm excited to be here with you and all these fabulous people. And I'm one of your biggest fanboys, so thrilled that you are our host today. My name is Matt Medina. Like Bria said, I'm a certified nurse midwife and a labor and delivery nurse at Brigham and Women's Hospital in Boston. I also work at Boston Medical Center, our safety net hospital. I wear a lot of hats between my job, my side job, but also with AWHONN. So I'm very honored to be here. I am the current chair of the AWHONN's Men's Special Interest Group, or SIG, outgoing. I joined the board of directors in January and will no longer be the chair. But I am thrilled to be here and to have this conversation about what it is to be an obstetric unicorn, as Gabe has said in the past. And how I got into maternal child nursing. I don't actually know. I when I was a kid, like kindergarten, I would say that I wanted to deliver babies and drive a bus. And I've never driven a bus, but I do get to deliver babies. And when I went to nursing school, I went in with an open mind, assuming that I wanted labor and delivery, but wanted to experience it all. And as I say, labor and delivery didn't scare me away. So I stayed, and that's where I landed in my career for my entirety of my nursing career.
All right, so it's my turn. So my name is Curry Bordelon. I'm faculty at, as we said, at UB School of Nursing. I've been in practice as a neonatal nurse and neonatal nurse practitioner for over 28 years. When I first started off in my BSN program for various, for a location in Louisiana, I initially in our final residency program, you received your allocation of where you're going to go for that semester, and it was adult ER. And I had no desire to be in the adult ER or adult care for that matter. And then I did an even swap with someone else who had the neonatal intensive care who didn't want to be there. So it really worked out to be that lifelong career and that dream of being in that space with those very vulnerable patients and getting to really interact with patient families at a very different level, because that's such an integral part of what we're doing in the neonatal intensive care. But as Matt, others have said, that we are those unicorns in a way that there are very few, if any, men in many neonatal intensive care units. But also, as I became a neonatal nurse practitioner, even a smaller number. So as with Matt, I carry many different hats, both in academic, along with clinical practice. And I also do a lot of leadership work, service leadership with the Men in Nursing organization that we'll talk more about later, along with the Academy on Neonatal Nursing as the educational liaison, and also editorial work within the Neonatal Network and other journals as well. So I've had a lot of experience in the neonatal space. That's really been my home. And it's served well as far as me mentoring others, not only in practice, but in academics.
Right, so I guess it's my turn. When I was in school back in 2015 and 2016, I thought I wanted to be an ED nurse. On TV, that's what the cool people do. And I got into my clinicals and realized that it was not my space. And I got into psych and loved psych. And then I got into labor and delivery and loved labor and delivery because it was a combination of emergency nursing and psych and all of the things that go into like therapeutic communication and things like that. So, when I realized how much autonomy that we had up in that space and the work that we got to do, and the majority of the time it was a good time. And when it was a bad time, we got to do good work. Um, I just fell in love. And so that's how I earned my way into the labor and delivery space. I went into labor and delivery straight out of school. I've been in this space for almost 9 years. 9 years, something like that. I do a little bit of everything: triage, transport. I fly. I take the ambulances. I do labors, I do antepartum. It's been a journey and it's been fun.
I guess that makes it my turn. My name's Eric Ruiz. I am a labor and delivery nurse out of Bay State here in Springfield, Massachusetts. Kind of the same thing. I'm a U.S. veteran. I always wanted to become a nurse. And so I took that journey a little late in life in my 30s. And when I got to school, I just had this crazy idea, like being in war and then wanting to like maybe finish your life doing something else in service of others. I fell in love with maternity, and I'm a struggle bus student. So I excelled in maternity. I mean, I had amazing grades, and I think how it is in nursing that they always say, like maternity is really hard to get into, and our school only had 2 spots, and I would hound the professors to get into that spot, and I was lucky enough to get there. I met some great nurses who advocated for me. Unfortunately, I didn't land in maternity when I graduated, but I did interview 4 times and applied 15 times. And I think their statement was, "We've seen your name so many times." And I responded with, "If you just give me the job, you'll stop seeing my name come across your desk." And I've been there for 9 years and I love it. I'm kind of like all of you, a jack of all trades. I'm a triage coordinator for our unit. I do the operating room. I am our EFM instructor. I work across our C-section floor, antepartum, postpartum, high risk, and all those areas. And there is nothing better to me than working in women's health and helping families grow and watching the birth of their children.
Thank you so much for giving us a little bit of insight into all the different ways that you each got into this. And Matt, I would say I probably wouldn't get on a bus with you, but as you and I both have Jeeps, as we have discovered, I would probably ride in the Jeep with you. The bus, I don't know, not so much. But I think I can relate as a labor nurse who has left the bedside. I pause when I consider calling myself a former labor nurse because I feel like there's no such thing as a former labor nurse. Like once you are a labor nurse at some point in your life, it sticks with you. It's like part of your identity and part of your life, and it becomes like a little bit of who you are. And I went to nursing school really late in my career, like Eric. I was 36, and just I identified so much with a lot of the things that you said, especially Gabe, like when you were talking about, you know, all the different things that we get to do in especially in inpatient obstetrics. I think that it's like the best specialty because you're never bored. There are so many different things you can do. You can do, operating room, and just being present in these birth spaces, even when things are hard and scary and sad. That's when we do the best the best nursing, I think, of our careers, and we always remember those spaces that we're in. But I really think that we can just do amazing things, and it sounds like all of you are doing that. So I wanted to throw a question to Matt, just about, a little bit about your career. Can you tell us about one of the most or some of the most rewarding aspects of your career in nursing? And can you also maybe tell us a little bit about how you refer to yourself? Because you refer to yourself in a special way when you tell us like what you do. You like say, I'm a midwife and I'm a nurse. Can you maybe talk a little bit about that and then some rewarding aspects of your career?
Yeah. I refer to myself in that way because I still identify as a labor and delivery nurse, even as a midwife. I've been a labor nurse longer than I've been a midwife. I've been a labor nurse for 13 years, and a midwife for 5. Um, I love both my jobs, and they are both so unique, but at the same time, there's so much overlap as well. Um, I have had the benefit in my entire career of always having um, a peer that I can look up to in many ways. So when I started as a labor nurse, one of the charge nurses on the labor and delivery unit was a man. And so I right off the bat, I had this person that I could look up to and feel like I wasn't alone on the unit. Um, and that same truth was for when I started wearing my AWHONN hats. Our section chair at the time was Brian Cujan, and he is he's my AWHONN mentor, one of a couple, and just being able to always feel like I had um, someone that had at least a similar lived experience as a labor nurse. Um, and then thankfully, when I went to Bay State, I went to Bay State midwifery education program at Bay State Health where Eric works, and I had heard a million and one things about Eric, and it just made me feel instantly calmer to know that I had the same opportunity to have somebody that I could look up to, that people weren't going to right off the bat um, think it was strange to be there as a midwife student who was a man. Um, am I answering your question, Jimmy? I'm sorry. Okay, all right. Um, I have had so many wonderful births and experiences working, and it's never dull. It never gets old. I think that's like my favorite part of my career is that every day is different. And even when things seem to be the same, it's a totally different story in your brain when you're remembering um the different things that you've come across and the different people that you've supported. And everybody's birth story is different, and we're part of those birth stories. And it's just probably my favorite part of my career is being able to be part of people's birth stories, and encourage them to use their voice and speak up in their care.
Yes, I love all of that. And as somebody who I think really dives into the storytelling aspect of it, I have found myself saying that to the same thing, very frequently. That you, as a labor nurse or as somebody who is involved in the birth, the birth and the growth of families, you have the opportunity to become part of their story. They're going to tell that story over and over and over again, and to be able to impact that is super super cool. I wanted to ask Gabe something. Gabe, I wanted to ask you. What do you think are some of the biggest challenges that you may have faced as a man in nursing? And can you maybe tell us a little bit about how you have navigated some of those? And then after you answer, I want to see if anybody else, maybe Eric or Curry, want to jump in as well.
So I've been doing this for a fair bit. I've been a labor and delivery nurse since the late 90s. And my biggest challenge actually happened straight out of the gate. And that was when I was establishing myself on my unit, and the staff really didn't know what to do with a guy on the unit. And when they were going in and saying, "Hey, your new nurse is going to be so and so, and they happen to be a guy. How do you feel about that?" Everyone has a negative aspect to themselves or a negative quality. Everyone has a positive quality. And when I was presented in that way, it was received not in necessarily a super positive light. And it made for challenging conversations. I had critical conversations with those nurses during that period and said, hey, let me have the opportunity to meet my patient. Let me have the opportunity to establish rapport. Let me have the opportunity to talk to them and make myself known as an expert in this space. And after I had those conversations, and when I'm saying that it was a problem, it really wasn't for a very long time. It was just for a brief period, had a couple critical conversations, and then after that, there was never an issue. I really don't run into very many issues when I'm getting report on patients. Every now and then you'll get a situation where um, someone will seem a little standoffish, and in those situations, I like to pull up my stool and sit down and just talk and see what they have to say, see what they want to get out of their birth experience, talk to the family in the room, talk to the patient that's delivering. And once you really establish yourself as a genuine expert in the space, there's almost never any issues with moving forward. Occasionally, there are religious issues, and that's fine. We really work hard on my unit to make sure that we're navigating those well, to make sure that we're not putting me or them in a weird situation. And it's pretty easy to establish. I mean, even before I walk through the door, who is going to have issues with different care providers. But yeah, does that answer your question?
Yes, absolutely. Thank you so much. Do Eric or Curry, I see you've come off mute. Do you want to go? Cool, thanks.
Certainly, and I have a parallel story from the neonatal intensive care area. When I first started practice as a nurse in the in neonatal intensive care, it was in a Catholic hospital in Louisiana. So that kind of paints the picture there a little bit. But there was some resistance at the very beginning, not only from, surprisingly, not just from the mothers really warmed up in a very quick way because there's someone there to help them, make them feel included, and really feel like that's their space to enjoy their newborn. It's the fathers that I found most difficult in some cases, especially when I'm trying to help the mother breastfeed. So all this different training and all this different experience, all these different things that we've learned, not in academic, but actually in the clinical practice space, of being able to help the parents do what they want to do. Let them feel like they're parenting, let them feel like they're bathing or feeding, or let them feel a part of the decision-making process. It was one of those things you had to get over that barrier, and then once you got over that barrier initially, it was to the point of nurses being asked, "Hey, when does Curry work again?" Or whatever it might be, and that's just really because there was a space, like Gage said, is you pull up a chair, you sit, and you communicate. We, unfortunately, in nursing have gotten so task busy with our day to day that it sometimes pulls us away from that human piece of being able to sit and have a conversation. So as we're doing that more and more, making that realism, and that's one of the things I do in the academic side, is teach students there's a patient, there's a family, there's an infant, there are people in the room other than your charting EHR. There's more than just your latest lab. There's more than a phone call that you walk in as you're walking into the patient room or that bedside for that neonatal patient. It really is about that's the moment that you're in the present. You're in that space for that moment. And so when you make families feel like they're welcome in that space, it creates a different level of rapport. Then the gender kind of fades away because it's about are you present? Do I feel special? Can you communicate with me? I feel like I understand what's going on now because the parents typically are stressed. In labor delivery setting, it might be in the antepartum space for a while, but once they deliver, they move into the neonatal intensive space for sometimes months. That becomes a second home. It may not be obviously the most comfortable home, but it's one of those things that you have a feeling like I want to bond, I want to be that parent. And they're grieving that loss of being able to do that as 90% of the other babies are doing. It's very difficult for them to be able to have that transition. But we as nurses in those spaces, regardless of gender, have that responsibility to help them in that transitional period.
Well, and echoing off of what Curry is saying, bridging the gap between the delivering patient and their partner, I really press into bringing the partner into the delivery. I cannot tell you the number of times that I have made, strongly encouraged the delivering partner to help deliver the baby. Because if they are not going to fall on the floor, they can be a part of the whole process. And there's really not a whole lot that they can do leading up until that moment. And just bringing them in, and I mean, even going to what Curry said with regards to helping breastfeed, when I'm helping get a baby latched, I like to bring the partner in and help show them how to position the breast and get the baby on and really involve them in the process, and then take a step back once they show that they're interested and picking up on the things that I'm trying to teach them.
I want to jump in real fast, and then Eric, if you want to add anything, I would love to hear your input about that. But I really love that. And as Curry, you were kind of talking about engaging family. It did make me wonder if all of you can connect with either the delivering partner or the father in the room, if you were able to engage them a little bit better, because, you have that sort of identification with them. So I love that. And Gabe, it made me think of like, when I came home and was nursing both of my children, when you have difficulties and you have a partner that might want to help, but nobody engaged them to sort of show them how to help or teach them how to help, they're not necessarily going to be able to. And then they're going to feel a little bit powerless because they don't really have either the words or the skill because nobody really took the time to show that to them. So I love that you can engage with people in that way and give those partners, not just the participation in the birth, which is so, so important, but also give them tools to help. And I think that from the side that the work that I do now, which is, more on the maternal mortality side, we do see a lot more engagement in the fatherhood space, because we have these, partners who are now, trying to figure out how to raise babies without the mother or the birth parent who didn't survive for some reason. So I am definitely seeing a larger movement to engage fathers, and I love that you were able to speak to that. So thank you for that. Eric, jump in. Did you want to add some stuff into here, please?
No, I would just echo the same thing that Gabe and Curry and Matt have said, that um, being inclusive of partners is so important. I want to echo the same thing. On my unit, the biggest challenge in the beginning was being introduced as a male labor and delivery nurse to every patient. And it took a lot of like hard conversations and being, strong with people in your words, that please don't quantify me to my gender. A nurse is a nurse is a nurse. And walking into that room with a perception already being presented that male means different doesn't bode confidence. And what I would just tell the nurses, and I'm sure similar conversations as everybody else, is let my own light shine when I walk in the room. Let my confidence, let my expertise be what speaks for the care that they're about to receive, not the gender. And I'm sure, like many of you, I rarely am refused outside of cultural or religious beliefs. And we really kind of have changed the language on our unit, from introducing the men that work on our unit by their gender, and moving towards experience. And I cannot tell you how many times I've turned around a partner, like Curry saying, like the pushback is usually the partner. I 100% agree with him, by bringing them in, especially during those moments which may seem a little bit more intimate, such as helping a baby latch and breastfeeding and touch. I always like to joke that, mom only has two hands and she just birthed y'all's baby. Your hands 3 and 4 to help get that baby on and keep the baby interested and latched and feeding, and that bonding is so important. And I do skin to skin with dad and or the partner equally as the birthing person, to make it a family experience. And I think that's where the difference changes, and the resistance just, I think it just melts away when we don't add a layer of resistance like male nurse or a guy who's going to take care of you.
So I want to tell a little story. So we have 2 children. My partner and I have 2 children, been together for 21 plus years. We have 2 children, both adopted. One was from California with a very difficult prenatal history, twin birth. A twin sister died at birth, 8 weeks early. You go down as a neonatal nurse practitioner, the things, you hear these stories of things that could possibly go wrong with me as a nurse in that space. And all deeply in healthcare, long history in healthcare, understand the ins and outs, understand 32 weeks, this is what the expectations are, and so forth, and what needs to happen. Well, so we fly out to California at UC Irvine. Our 12, he's now 12, is at UC Irvine delivered, and to go from that space of being a practitioner to a parent. And as a same sex couple in that space where the partner has zero healthcare knowledge. So it is very difficult in a way to be in that space, and most everybody's thinking, oh, that one of the parents is a nurse practitioner. I don't want to take care of that baby. When they come around to realize that we're there for parents, when you talked about skin to skin just a minute, Eric, it was incredibly important that the place that we were, they were very open, had male nurses, had male nurse practitioners, and they were very accommodating to ask, do you all want to skin to skin? Do you want to do this? Do you want donor milk? All those appropriate things that you think, that we've set in place in neonatal intensive cares as being a standard of practice was secondhand. And I'll tell you that experience of recognizing the benefit of the father being able to skin for the baby was incredibly powerful. And that made a world of difference in that preparedness to be able to post discharge. Okay, I could do this. That feeling, okay, I can do this. When many parents, especially in short-lived, whether it be labor delivery of a term baby with no complications, a lot of times the fathers may not feel like they're ready. But in the space of being able to do that in our world of males talking to those fathers, give them that little bit of someone like me is speaking to me. Someone like me is hearing me, and they're giving me advice that I'm going to, to latch onto, no pun, but is trying to figure out a way that you can communicate with those families. Because to be honest, it's about those aren't our kids, they're their kids. We're coaching them to get them to a space that they can be optimal parents and feel really inclusive. That sets up long-term success that, you know, that's gold. That's the way that you're wanting to do this as a nurse. But I've lived in that side, both sides, and I will tell you, there's remarkable people very specifically that I can definitely recall. Some we still have engagements with based on that experience.
I love that. I love talking to you guys. You're all so amazing. It made me think of like mentorship, right? And I think that I have been so lucky to have really strong mentors in my career. And Matt has spoken to that. Eric, do you have any examples of mentorship, either giving or receiving? Being a mentor or having a mentor, and how that might have impacted your career.
Yeah, for me, my mentors when I started were the women on my unit. Um, I had a very strong preceptor, and she's somebody that I strived to be like during that. I mean, she made me cry so much during orientation, but she was just so tough, and she became like somebody who taught me to not take anything from anybody, in the sense of owning my space where I belonged. And I was lucky enough that I was mentored by nurses at my college that also worked on the unit. So it was a nice transition to have them there supporting me. And right now we have another nurse who happens to be male, and it was he who kind of sought me out and talked about all the challenging things that he was experiencing that felt like I also went through, and kind of was able to like mentor him through getting through the door, and also making his own space with us. Uh, I think it's sometimes challenging if you don't have somebody um, like you, right?
Yeah.
Everybody looks different, and you feel like an outsider. Um, you Yeah, I think that bodes another challenge for you, but I hope that I've been a small mentor to him, being in the space already and opening kind of the door and being one of the first men to ever work on our unit.
Did any of the rest of you had anything to add to that, or can any of you think of examples of mentorship that you want to talk about?
I also started at a smaller facility before I went to the facility that I'm at right now. And when I started there, there was also another male that kind of took me underneath his wing and helped me kind of navigate the transitional period from school into the world of OB. And so that was super helpful. Um, that being said, then I transitioned over to the facility that I'm at right now, and I had kind of my feet underneath me. Was another male, but he was relatively new at my facility, so it wasn't like he was mentoring me, but it was an opportunity for me to kind of partner with him and kind of learn from each other and transition with each other. Now I'm the only one. But then going back to the mentorship question, um, I had someone that trained me that really kind of took me under her wing and really kind of showed me the ropes along the way. And I hold her dearly. I remember my first stat C section with her, and after the section, it was a train wreck, and we got back to the room, we got the patient recovered, we got the patient postpartum, and she pulled me aside and she said, "What went wrong with that whole situation?" And I said, "Well, everything was tangled and we couldn't get out of the room." And that will live with me forever. Um, but yeah, you'll have those people along the way that really mentor you. Going back to what Eric said, having a male to male mentor is helpful. I don't think it's absolutely necessary. You just have to kind of introduce yourself into the space in a way where you find your peers that are willing to listen and embrace and see what you are trying to do and what you are passionate about. I've told orientees before that I've trained, um, if a guy is going into OB, he is either crazy or he is uber passionate about this entire world. And so most of the time, and I've never met anyone on the other end of the spectrum. Most of the time, they're uber passionate about this entire world. And so pressing into helping them learn and develop the ability to obtain good quality consent and develop rapport, those are all super important things.
Yeah. Thank you for adding that. And it made me laugh because I had a fall once in the hospital heading to the OR for a stat section, and I was at the bedside and trying to move the bed along, and I had not unplugged the monitors, and so I fell backwards. I tripped over them. I was fine, but my ego was hurt more than anything. But I could talk to you all day, but we're gonna have one more question for time purposes, and I wanted to start with Curry because you are the president of the American Association for Men in Nursing. And Matt, maybe after this, I'd like you to add a little bit to this. I would love to hear how your involvement in professional associations helps you sort of build a community of support for you and for other men who are coming up in the field of women's health nursing or in any nursing area.
Sure, thank you. In the role over time, I've been with the organization for some years now, and so I've worked myself up on the board, and we've just started the men's Health Nursing Alliance. That's going to be a lot of educational content over the next couple of years to really build out not only awareness of men's health concerns, but also for fathers. And I'm putting a very deliberate spin on that as well with some publications and different things that I'm doing with supporting fathers in the NICU and supporting, letting the father's voice be heard. So of this is a result of a lot of the leadership and engagement that I've done in these national professional nursing organizations. So I've been very fortunate over time to have, my neonatal space, I'm in a nursing space, and being able to allow them to intersect in a very meaningful way. And that provided a lot of opportunity for this sort of engagement. So the Men in Nursing organization, the American Association for Men in Nursing, is focused not only on diversification of the workforce, because as we have reiterated here, our patients and families want to see themselves. They want to see people like them when they're having conversations. There's plenty of evidence that indicates there's higher levels of improved patient outcomes and patient satisfaction and collaboration of care. And there's a lot of positive benefits to that. The really frustrating part sometimes is our very slow increase of the number of men in nursing, sitting only for, it depends on what you look at, 14 to 17%. It's really quite low, 12% in some cases. So again, it's very frustrating to see, but at the same time, if you look back longitudinally over the last 20 years, we broke the 10% mark and we're slowly climbing. But at the same time, we have to have this voice to give people permission. Many people who already struggle with a male getting in nursing, but then there's certain tracks that tend to gravitate more male nurses when there's a lot of opportunity, as we're demonstrating here, to have a more gender diverse workforce. That's where we come in to be that voice, to be representatives for these professional organizations and give people permission to be in the career they want to be in, not one they just select to be in out of fear of really wanting to be where they want to be. We have all provided examples of what's motivated us to be in a very unique field of practice for our genders, our male genders, less than 2%. If you look at it in this particular way, we've done so by being that voice of, hey, you too can do this. These are the barriers that you might find, but this is how you can overcome it. These are the obstacles you might see, but this is how you can overcome it. It's a recognition there. It will not be 100% cakewalk. It will be some barriers here and there, whether it be from HR perspective, geographic location where you're working, stereotypes, all of these stigmas. You will run into those, but once you've established yourself as an expert and that caring individual, then that becomes the foci and less about the gender.
Matt, did you want to add a little bit on in terms of like maybe how some of your work with, in the various aspects of AWHONN, have contributed as well to, connecting, in your work?
Yes, absolutely. Thank you. I think of Gabe had just said something that was my segue, but I forget what my segue was. But now I remember. I'll pause for a second. Gabe had said that when you're getting into perinatal nursing, you're either crazy or super uber passionate about the space. And for me, actually, I don't think I'm crazy. I do think I'm super uber passionate about the space. But I remember looking for a job and just feeling like Eric said, like I've applied 15 times, like somebody's got to give me a chance here. And so I spent a lot of time trying to prove that I wasn't that random applicant who was applying for every job or a weirdo. And I knew I had to strengthen my resume. And so what I did is I took ACLS, I took NRP, I did all these things. But most important to me was I joined AWHONN. I've actually been an AWHONN member longer than I've been a perinatal nurse. I joined when I was still a student because I knew the power of your professional organization and the importance of including that into your practice. A1 informs everything we do in this space, and we are the standard setting organization. So knowing that someone could look at my resume and see, oh, he's a member of AWHONN. He must be taking this very seriously and really wants to be in this space. He's not he's not crazy. He is uber super passionate about this field. Um, and I think that the membership in our professional organizations across our whole diaspora of nursing, whether it's a practice-based organization like AWHONN or a gender-focused organization like the American Association. I used to be a member, Curry, too. I'm not at the moment, but I might have to rejoin. I was in the assembly days before it was the association. But that power to be able to inform your training and inform your care from a place of standard setting is so powerful and so important to our especially our people who are trying to break into the field, so to speak, or to be thought of more than our gender, and that we belong in this space. That's always been my message: is we belong here. We are supportive to these families. We give we shed a light on things that from a completely different side of the crystal that um, our counterparts and our peers may be able to shed light on. So we belong here, and I'm glad that you're all here with us today. This is amazing.
Yes, I love that. And somebody recommended when I was in nursing school that I join AWHONN and join my professional association because I knew right away that I wanted to do maternity nursing. And that's why went to nursing school to begin with. And so, like you, I have been a member of AWHONN longer than I actually have been a registered nurse. So that exceeds my nursing career so far as my membership. In professional organizations, and they're so great for just staying connected with people, and that I found has carried me through a lot of really hard times, whether it's through the pandemic, or just like times when I have felt isolated as a nurse, or had maybe a hard situation on the floor. um, you know I wanted to just ask one more. I'm adding on another question. Just building on what we just talked about, I'd love to talk a little bit about, to Gabe and Matt or Eric, about how you maybe have connected with other nurses through Labor and Delivery Nurses Rock. So I know you're both admins of that. I am occasionally on that page as well, kind of looking around. Can you maybe talk a little bit about how you, are on that platform, and how that helps you connect with other nurses in our field? We can start with Gabe. Is that okay?
Oh, sorry. Yeah, no, I had the opportunity to join Labor and Delivery Nurses Rock back, about a year after I became a labor nurse. We had about, 6 or 8,000 members at that point, and we're up to almost 80,000, I think. It was deliberately a very, clinically based group. And so we really tried hard to make sure that we are keeping the content directed that way. I mean, we have some fun along the way, but yeah, it's been something that has been a networking opportunity. It's led us into partnering with AWHONN, and we were at the last AWHONN convention, and got to meet a ton of people and really kind of put names to faces. It's been yeah, it's been a good place. Interestingly, my facility has actually adopted a couple of different practices that have actually came out of anecdotal experiences that have been shared on the group. And we're working on some studies, and I can't share much more than that right now, but yeah, it's been an exciting journey.
I have to echo what Gabe says. I shortly after becoming a labor and delivery nurse, also became an admin on Labor and Delivery Nurses Rock, And it's just such a great space. We talk about like-mindedness and peers. You you get to grow on Labor and Delivery Nurses Rock because you get to see the different things that are done across the region, across the country, across the world, because there's such a diverse group that's part of this Facebook group. And I too have brought a lot of experiences and techniques from other group members to the bedside and to the unit that we've also adopted. So I think it's a great resource. It's a great learning environment. It's a great place for advocacy and knowledge and just sharing space with birth workers. And I think it's important to say that it's a space for birth workers, people who work within the birth space. It's not just nurses, it's everybody. It's DNPs, it's FNPs, it's NICU, it's just anything and everybody that works within the birth space. And that just is just a big mesh ball of knowledge that anybody can benefit from.
And one of the other challenges that we have here in the United States right now is the growing OB desert. And it's from being on the transport OB nurse side of things, it's not just lack of access to care, it's lack of access to quality care. And when you have an opportunity for nurses to get out there and have exposure to people that are in tune with quality care, in touch with providers that are up to the nines with the best practices, and sharing that information across the country, we're finding that people that just don't know or don't have access to resources are finding that mm, finding some quality answers and quality direction in our space.
Yeah, I love that, and I think that I think we really see, in the sort of the public health spaces that I work in now, you really see how different things are, not only from, state to state, but even within, certain states, there can be so much variety, of care, right? And I definitely think that, I'm glad that you're talking about that and addressing things like that there, because I think that so often, for those of us who either currently work or worked in the inpatient side, we were so focused on the person as they present to us that we kind of forget where they came from and where they're going after they leave us. And that oftentimes will leave out sort of the all of the influences on their health, like the social influences and social determinants of health, and how that impacts them, and how they present to us. Whether it's how their birth is going to go, or their initial health, when they show up to receive our care. I think that we have a lot to learn in terms of inpatient nursing on sort of that whole spectrum. So I love that you are, talking about those things there, and that we have these spaces for all of us to learn from each other, because it's really going to, matter as we see things like that happen, where units are closing and everything like that. It doesn't just impact the patients; it impacts us as nurses as well. So I think we're going to wrap it up and toss it over to Bria. Does anybody else have anything that they want to add in? No? Well, thank you so, so much. It has been such a pleasure. And, I think we could spin off a conversation, talk about so many of these other things, but I really appreciate all of your time, and sharing your expertise and experiences with us today. Bria,
I
it's all yours.
certainly think that there is so much more to discuss. This was really it was a great conversation, and I appreciate you all opening up, sharing all your personal experience with me and Jamie and all of our listeners today. What I really love is that you all each described how you recognized and you felt that certainty when you got into the field. Like, there are no questions like, maybe I'm not in the right space, right? You found your fit. And then all of you, from what I heard, have been mentored well. And then it sounds like you're mentoring others. You're giving that back that you received. So that's really awesome. I just want to phrase like the unicorn in a positive light because I see it as you all being one of a kind more so than just being the one male, at least when you started off in the field. And you all come with some really great communication tools. I think that makes you special. And you've described what a wonderful job you do of welcoming in the partners. And you talk about how you advocate for yourself. You're asking people, don't look at me differently. Look at me based on my expertise. And you went out and you got the expertise. So I hope that our listeners are picking up on the tips that you were giving out. And thank you for sharing how great of a space Labor and Delivery Nurses Rock is, the space for other birth workers. If people are interested, we'll make sure that we put that in our resources. So for everyone listening, you just heard our last podcast for 2024. Thank you so much for the privilege of your time all year long. Thank you to our guests, to Matt, Gabe, Curry, and Eric. Their bios are going to be posted on awhon.org/podcast. So we ask that you go there. You can listen to all of our other episodes. Each one of them has some sort of step or some sort of tips that you can use to better care for yourself, for pregnant and postpartum people and their newborns, and for your colleagues, your family, and your community. So please have a safe holiday. Seek joy as you enter the new year. And check us out on streaming. You can watch us on YouTube. We ask that you recommend this podcast to at least one or two of your friends and send us a comment, or you can like us on the streaming services. Thank you all again so much. Everyone, be well and stay safe.